So good morning to all of you. For the start, I would like to say that this week I got some kind of a cold, and I even completely lost my voice. That was on Thursday, and I really thought that I will not be able to talk to here today. But one application of autopathy from my favorite preparation helped me tremendously, and my voice in a couple of hours. So I am so grateful for this healing method as it helped me so many times with so many different things. So first of all, I would like to introduce myself. My name is Andrea, and homeopathy has been a part of my life since childhood. And thanks to the studies at the Homeopathic Academy, I came to autopathy. And yeah, for a couple of years, I've been using it to support my health and people around me. And only recently, I decided to open my own practice where I use both homeopathy and autopathy as healing methods. So now I will present to you a case from my practice from August last year. So this was, as I said, a case of a 36-year-old woman who came to me with Epstein-Barr virus infection, the mononucleosis, which started in May. So it's been 3 months before she came. And it started with high fevers of around 38 degrees Celsius, severe sore throat, cough, enlarged lymph nodes in the groin and the neck. And she said these enlarged painful lymph nodes often appear chronically as well. Unfortunately, she was misdiagnosed at first, and she was on 2 courses of different antibiotics, and there was no improvement in her condition. So only afterwards, when the tests were made, high levels of antibodies against Epstein-Barr virus and chlamydia in the lungs were detected. So when she came to me, she had constantly increased body temperature of 37.2 degrees Celsius for the last 2 months. She was very, very tired and she was desperate. She said that she didn't know how long it might still last. She used to be very active. She used to go for long walks, but at the time she could not go for any walks at all. She was exhausted from every small activity, during which she suffered from shortness of breath. And yeah, she mentioned that at the time she hadn't been able to work at all, like she was on sick leave. And yeah, I asked her what happened before the illness came, and she said that she worked a lot. She's an architect, and she's self-employed, and she used to work long hours until 4 a.m. And she also said that 1.5 years ago, she broke down mentally because she kept overworking herself regularly. And at the time, she also mentioned that she hit the bottom. Yeah, so that was what she came with. Afterwards, I asked her about other health problems, if there are any. And she said she had atopic eczema since she was little. And it disappeared, but various allergies appeared. And she said that this eczema was located on forearms, inner thighs, and hands, and the skin was quite dry, and she needed to use moisturizers. She had also tendency to get constipated. And yeah, one more thing was that before the period, she felt always unwell. She got sick to her stomach, and she had pain and cramps in lower abdomen. And yeah, and one last thing was that she used to have sinus infection regularly in the past. So as it was actually originally a homeopathic interview, I asked her a couple of more questions to get the whole picture. So I asked her about her likes and dislikes and eating and drinking habits and so on. So she said she enjoys working. She likes going to nature, doing sports, listening to music. She likes culture. She said she likes everything to eat, especially sweets, meat and eggs. That she drinks 2.5 liters of water and a tea a day. She prefers lukewarm and warm drinks, but naturally she's not thirsty. She likes summer and the sun, but also sunny winter. She doesn't like unpleasant humid weather. So, and the last question I asked was, what is she concerned about and what is she worried about? She said she's concerned about her health a lot, that she's worried about having enough money to work, and that security is important. She also mentioned she's very chilly. And when I asked her about her personality, she said she's very goal-oriented, hardworking, thorough, and stubborn. So that was the case. This is the situation she came to me with. And I had an online consultation with this client, and I've never seen her before. And what was interesting was that a couple of minutes before we connected online, I heard a voice in my head telling me that she will need autopathy from heated breath. And it felt like an information, what to do with her was sent to me. So I was quite happy at the time, not because she was sick, but because I had two good options what to do. And one was the autopathy from heated breath, and second one was a homeopathic remedy, Calcarea carbonica, which suited the case very well. But because of the high load of the Epstein-Barr virus and the chlamydia in the body, and also the abnormal liver values, and of course also the intuition, I decided to go with autopathy from heated breath. So at first, I suggested that she would do only 1.5 liters dilution because of low vitality every other day 4 times, and then to call me to see how she reacted to it. So the first follow-up, after the first 3 applications of this 1.5 liter heated breath, she had pain in the area of her sinus, and she got chills, she got a headache, the lymph nodes swelled and got more painful, and she quickly fell asleep. And after the 4th application, she was only tired for 1 day. So she reported, however, that for the first time, she felt a little bit better overall. So, but she also mentioned that she had no strength and she still suffered from shortness of breath. So as we have seen, she reacted quite well to the first applications. There was some kind of a detoxification process, and afterwards she slightly improved. So I advised to her to continue with 1.5 liters, again 4 times, every other day, and then increase to 3 liters every 3rd day, and then 4.5 liter only once. So that was her program. And then in the follow-up, in the second follow-up, I was very happy because she said she feels about 80% better. That was a huge improvement. She has much more energy. She goes for walks now. The shortness of breath is almost gone. She has a good digestion, and even the last period she had was first time without any problems, pain, or swollen lymph nodes. So yeah, that was that was very great. And I recommended to her to continue with the 4.5 liter once a week for a month. And I increased the interval because in between the applications, because she was doing significantly better. Yes, so in the third follow-up, she came and she said that after the first application of 4.5 liter, she had a collapse and she spent 2 days in bed with fatigue and that her eczema came back. So her hands were covered in rash and the places where eczema used to occur as well. So after these 2 days, her eczema disappeared and her energy returned. So I was also happy about this process because the healing process follows the Hering's law of cure from the inside out. So basically the old pathology came to the surface, disappeared, and her energy returned. So other 3 applications of these 4.5 liter kept improving the level of energy and her overall state. So that was in November, and she said that in October she had her blood work and other tests done, and they came back completely back to normal. Even her immunologist was very, very surprised because yeah, her results were quite bad before. So she also said that she can go for long walks again, she can go swimming to cold waters again, and that she feels overall well and has energy to work again. So in this consultation, then I did not recommend anything to her as she was doing quite fine, with the understanding that she can call me at any time. Yeah, so what we have seen here is that basically autopathy from heated breath repeatedly from 1.5 liter to 4.5 liter resolved the subacute state of mononucleosis, which had persisted for 3 months before starting autopathy. And as a very nice side effect, also her chronic problems improved or disappeared along with the treatment of this subacute state. So afterwards, she called me mid of December and she told me she was doing still quite well, but that she would like to work on the fact that she tends to overwork herself and about her perception of work in general. So at that point, I gave her a homeopathic remedy. So yeah, so this was a case I wanted to share with you as another example how autopathy can bring us back to a healthy state, and to many it can actually give their life back. So it is a true blessing, and yeah, I'm very, very grateful. Thank you for your attention.
I have a question, if I may.
Yeah.
I was just wondering, since you do both homeopathy and autopathy, just going back to the beginning of your presentation, did you choose the autopathy because of the low vitality? Was that the key that made you choose that first over the homeopathy? And my second question is there ever a time when you use them both together as an intercurrent, like a homeopathic remedy?
Mm-hmm. Yeah, thank you for the question. It's a good one, really, because I was about both of the things I thought a lot. So to the first question, because I have seen the picture of the homeopathic remedy quite clearly, but I felt that I saw the report from the doctor, and the values were really not good, and I've seen, and also the high levels of antibodies. So there was a huge load of these microorganisms in the body, and when I see this, I feel like it's a good point to start with autopathy. And yeah, so that was the main reason why I decided to start with this one. And also, as I said, there was an intuition that played a huge role also in this case. So it was just not only the fact that that there was a huge load of these microorganisms in the body, but also the intuition that I just should start with this option, even I see the homeopathic remedy. and to see where it goes. And yeah, but actually it cleared up the case completely. So only then I decided to continue with the homeopathic remedy, because the topic she came with afterwards was more like some patterns of behavior that were imprinted in the subconscious mind, and I needed to change them. And I think that in this case, homeopathy can work better. And to the second question, if I use them both simultaneously, no, I don't. But I can use, with one client, I can use first autopathy and then see how it develops. And then I can switch to a remedy, or the other way around. I work with a remedy that I see the person is 80% better, and I don't see another remedy to continue, but there is still something bothering him. So I switch to autopathy. So this I do. Or I have I have someone and I don't see the remedy, or I see 5 different remedies and the case is quite, mixed. So I start with autopathy first, and it usually helps to increase the vitality of the person. So the remedy that is needed to be given afterwards is more clear, and because the pattern of the remedy gets more clear. So, and then I just continue with homeopathic remedies. So it's also intuitive process of how to combine these 2 methods, complementary in a way for me, and to see at certain phase what the person needs to bring the state of health further. Yeah.
Thank you. That's great. Interesting observation about using it to bring up the vitality to clear the picture for homeopathy. That's wonderful. Yeah. Thank you.
Yeah, because first of all, I have seen the remedy, what she needed, and the remedy has exactly the pattern what she was talking about, and if I see that, and I see that some pattern needs to be changed in the subconscious mind, because sometimes we have these, we carry some kind of imprints in the energy bodies, and they are deeply rooted, and we need to reverse them, then I go for homeopathy. So that was the reason I went with the remedy, because I clearly saw her pattern in the pattern of the remedy. Maybe if I wouldn't see it and it was some kind of a general improvement of psychological state, I would continue with prana.